A 72-year-old man once sat across from me in a quiet clinic room, his hands folded, his eyes steady, but carrying something unspoken. He said, almost cautiously, "Doctor, I've been doing things the same way for decades, but now something feels off." He was not sick in the traditional sense. His reports were not alarming. There were no new drugs, no sudden diagnosis, no dramatic change that could explain what he was feeling. And yet, something inside his body was quietly shifting. His energy was lower. His sensitivity had changed. His sense of satisfaction was different. And even his confidence had started to fade in a way he could not clearly describe. What he did not realize, and what most men never connect, is that sometimes the issue is not the act itself, but the pattern, the habit, and the physiology behind how it is being done over years and decades. When I see men in their 60s and 70s, I often explain one important truth that most people are never taught. The male body is not static. It evolves. The nervous system, circulation, hormonal response, and even brain chemistry adapt with age. What may have been harmless or even beneficial in younger years can slowly become maladaptive when repeated in the same way without adjustment. Masturbation itself is not the enemy. In fact, in a balanced and mindful form, it can support prostate health, relieve stress, and maintain sexual function. But the problem begins when unconscious habits, overstimulation, or mechanical repetition replace awareness. The body starts responding differently, not because it is failing, but because it is adapting to the signals it is repeatedly given. Over the past 12 years of working with older men, I have noticed a quiet pattern. Many of them assume that changes in pleasure, stamina, or sensitivity are simply normal aging. But when we go deeper, we often discover that subtle behavioral patterns are playing a much larger role than expected. These are not dramatic mistakes. They are small, repeated habits that accumulate over time and gradually reshape how the nervous system experiences reward and how the pelvic organs respond to stimulation. And the most important part is this: none of these changes happen overnight. They develop slowly, silently, and without pain until one day the man notices that something fundamental has shifted in how his body feels and responds. This is why I want to walk you through what I consider the most important 7 mistakes older men unknowingly make in their private habits, and more importantly, how these mistakes can be corrected before they affect long-term vitality. The goal here is not shame, fear, or restriction. The goal is awareness. Because once a man understands what is happening inside his body, he can reverse many of these patterns with surprisingly simple adjustments. And I will be honest with you. The first mistake alone explains why so many men describe a gradual numbing of pleasure that they cannot otherwise explain. One of the most common issues I see begins not in the body, but in the brain. Over time, many men develop a reliance on high-intensity visual stimulation as the primary trigger for arousal. This is something they rarely question because it is easily accessible and seemingly harmless. However, the human brain, particularly the dopamine system, is designed around balance, novelty in moderation, and natural stimulation. Dopamine is not just about pleasure, it is about anticipation, motivation, and emotional reward. When the brain is repeatedly exposed to extremely high levels of artificial stimulation, especially in rapid, varied sequences, it begins to adapt by reducing sensitivity. This is not punishment, it is neurobiology. The brain is simply trying to protect itself from overstimulation. The consequence of this adaptation is subtle at first. A man may notice that ordinary physical intimacy feels less intense. Natural touch feels less exciting. Emotional connection feels less stimulating than before. He may assume this is aging, but in reality, it is often a desensitization process in the reward circuitry. The brain has learned to expect a higher threshold of stimulation in order to feel the same level of response. This creates a cycle where more stimulation is needed for the same feeling, and gradually, natural forms of arousal feel less effective. This is not irreversible, but it does require intentional reset. When the brain is given time away from excessive stimulation, it slowly begins to restore sensitivity. Neural pathways begin to rebalance, and natural cues regain their strength. This is why even short periods of reduced visual overstimulation can significantly improve sensitivity and emotional response. The second pattern I often see is far more physical and far less discussed. Many older men develop habits of arousal in positions that unintentionally restrict circulation, particularly prolonged sitting in the bathroom or hunched postures. On the surface, this seems irrelevant, even convenient. But physiologically, posture matters more than most people realize. The pelvic region is a highly vascular area, dependent on consistent and healthy blood flow. When the body is compressed in a seated or strained position, blood circulation can become partially restricted, especially in individuals who already have age-related vascular changes. Over time, this can contribute to pelvic tension, reduced tissue oxygenation, and even subtle changes in urinary flow or sexual response. What makes this even more important is that circulation is not just about physical function, it is about signaling. The pelvic organs communicate constantly with the nervous system. When blood flow is optimal, the system is responsive, flexible, and well regulated. When it is restricted repeatedly in certain positions, the system begins to adapt to that limitation. This is why some men begin to notice dribbling after urination, reduced firmness, or a sense of pelvic heaviness without any clear medical diagnosis. These are not isolated issues. They are often part of a larger pattern of mechanical strain combined with aging physiology. A simple adjustment in posture, allowing the body to remain open, relaxed, and unrestricted, can significantly improve circulation and reduce these long-term effects. As we go deeper into these patterns, another critical issue emerges, one that has less to do with biology and more to do with behavior. Many men unknowingly begin to rush the entire experience of self-stimulation. It becomes something quick, mechanical, and goal-oriented. The focus shifts from sensation to completion, from presence to urgency, from awareness to release. This shift may seem insignificant, but it has profound effects on the nervous system. When the body is rushed, the sympathetic nervous system dominates the same system responsible for stress, fight or flight response, and tension. In this state, blood vessels constrict, breathing becomes shallow, and hormonal balance shifts away from relaxation and recovery. Over time, this creates a pattern where the body associates stimulation with tension rather than relaxation. Instead of a gradual buildup of pleasurable response, the experience becomes compressed, shortened, and less fulfilling. Many men describe feeling empty or drained afterward, not because of the act itself, but because of the physiological state in which it occurred. The body was never allowed to transition into parasympathetic dominance, the calm, restorative state where true satisfaction and hormonal balance occur. When this pattern repeats over years, the nervous system gradually loses its ability to fully engage in deep relaxation during intimacy, whether solo or with a partner. What is important to understand here is that the body is not judging speed or intention in a moral sense. It is responding biologically. A rush state signals urgency, not safety. And the male sexual response system is deeply dependent on perceived safety, relaxation, and rhythmic flow. When those elements are missing, the experience becomes mechanical. But the encouraging part is that this is reversible. When men slow down, breathe more deeply, and allow the experience to unfold without urgency, the nervous system responds almost immediately. Circulation improves, sensitivity increases, and emotional satisfaction returns in a way that often surprises them. And this brings us to a deeper realization that ties all of this together. The male body in later life does not require more intensity, more force, or more stimulation. It requires more awareness, more circulation, and more regulation. Most of the problems men experience are not because the system is broken, but because it has been pushed into patterns that no longer match its current physiology. Once those patterns are understood and adjusted, the body often responds with remarkable resilience. This is only the beginning of what needs to be understood. In the next part, we will go even deeper into the physical, muscular, and neurological habits that continue to silently influence male vitality after 60, including the pelvic floor, frequency balance, and the most damaging mistake that almost every man overlooks without realizing its long-term consequences. Continuing from where we left off, what becomes even more important as we move deeper into understanding male vitality after 60 is recognizing that the body is not just a collection of isolated systems. The nervous system, circulation, muscular control, hormonal signaling, and even emotional regulation are all deeply interconnected. When one area begins to decline or lose coordination, the others compensate for a while, but eventually the imbalance becomes noticeable. This is exactly why many men feel confused when they experience subtle changes in sexual response, bladder control, or overall pelvic strength, even though their general health seems fine on paper. What they are experiencing is not a sudden breakdown, but a gradual loss of integration between systems that once worked in perfect harmony. This brings us directly into one of the most overlooked yet essential foundations of male health, the pelvic floor. Most men go through life without ever consciously thinking about this group of muscles. Yet it silently supports almost every function related to urinary control, erectile strength, ejaculatory control, and even core stability. The pelvic floor is not a single muscle, but a network of deep muscles that act like a supportive hammock at the base of the pelvis. With age, especially after decades of prolonged sitting, stress, reduced mobility, and lack of targeted engagement, these muscles begin to weaken. And when they weaken, the effects are not immediately obvious. They build gradually. What I often see in clinical practice is that men assume reduced firmness or control is simply a vascular or hormonal issue. While those factors do play a role, the muscular foundation is just as important. If the pelvic floor loses tone, the ability to maintain pressure and support within the erectile tissue becomes compromised. Similarly, bladder control can become less precise, leading to subtle dribbling or urgency. Even sensation can feel reduced because the communication between muscles and nerves is no longer as efficient as it once was. The critical point here is that these muscles are trainable at any age. They respond to awareness, gentle contraction, and consistent engagement. But most men never activate them intentionally, and therefore they slowly lose functionality without realizing it. Another important observation is how habits during private moments can either strengthen or weaken this region. When the body is completely passive, or when there is excessive downward pressure, the pelvic floor is not engaged in a balanced way. Over time, this lack of engagement contributes to further weakening. On the other hand, gentle, mindful activation during natural arousal can actually improve circulation and restore neuromuscular communication. This is not about performance or technique. It is about reconnecting with a part of the body that has been largely ignored for decades. And when men begin to rebuild that awareness, even simple improvements in control and sensation can feel significant. Now, moving further into the patterns that quietly affect long-term health, we come to something that is often misunderstood and frequently either overdone or underappreciated. Frequency. Many men struggle with the question of how often is too often or how little is too little, especially as they age. What makes this complicated is that there is no universal number that applies to everyone. However, there is a physiological principle that does apply universally, and that is balance. The male reproductive and nervous systems function optimally when there is rhythm, not extremes. When the frequency is too high, especially without adequate recovery time, the body can begin to show signs of fatigue. This is not just physical fatigue, but also neurological and hormonal fatigue. Dopamine pathways become temporarily depleted, energy levels may feel lower, and the prostate can sometimes experience mild irritation due to repeated stimulation without sufficient rest. On the other hand, when the frequency becomes extremely low for extended periods, especially without any form of natural stimulation or circulation, tissues can become less responsive. Blood flow may decrease slightly, neural sensitivity may reduce, and the system can feel dormant rather than active. What I emphasize to most patients is not a strict rule, but a functional range. For many men in later life, a moderate and consistent rhythm tends to support the healthiest outcomes. The key is not counting frequency like a rigid prescription, but observing how the body responds afterward. Does it feel refreshed or drained? Does energy improve or decline? Does the system feel alive or stagnant? These internal signals are far more accurate than any external guideline. The body communicates constantly, but it requires attention to interpret correctly. However, even when frequency is balanced, there's another factor that silently undermines long-term sensitivity and function. And this is where we encounter one of the most physically impactful mistakes: excessive pressure. As men age, it is natural for sensitivity to change. Nerve endings may not respond with the same intensity as they once did. Unfortunately, many men interpret this as a need to increase force, grip, or intensity in order to compensate. While this may temporarily increase sensation, it creates long-term consequences that are often irreversible if continued for years. The penile tissue and surrounding nerves are delicate structures designed for sensitivity, not force. When excessive pressure is repeatedly applied, microtrauma can occur. Over time, this may lead to reduced elasticity in the tissue, decreased sensitivity, and in some cases, structural changes such as curvature. This condition does not develop overnight. It is the result of cumulative mechanical stress over time. The nervous system also adapts to this pattern. Instead of responding to gentle stimulation, it begins to require stronger input to achieve the same level of sensation. This is a form of desensitization, not improvement. What is important to understand is that increased force does not restore sensitivity, it suppresses it further. The nervous system responds far better to gentleness, variation, and patience. When stimulation is softer and more controlled, blood flow improves, nerve endings remain protected, and the brain continues to associate sensation with comfort rather than strain. Many men are surprised to discover that when they reduce pressure, sensitivity actually returns more naturally over time. This is because the system is no longer being constantly micro-injured or overstimulated in a mechanical way. Finally, we arrive at the most overlooked and yet most emotionally significant aspect of male private health: intention and emotional connection. This is not something that is often discussed in medical settings, but it has profound physiological implications. When any human experience becomes purely mechanical, the brain begins to disengage emotionally. Dopamine release becomes less tied to satisfaction and more tied to completion. Oxytocin, which plays a major role in bonding, relaxation, and emotional well-being, becomes significantly reduced. The result is a hollow experience, physically complete, but emotionally empty. Many older men quietly experience this shift without understanding it. They describe feeling nothing afterward, or a sense of emptiness that is difficult to explain. But this is not a loss of capacity, it is a loss of emotional integration. The body is still functioning, but the mind is not fully present in the experience. This disconnection can slowly affect overall well-being, mood stability, and even self-perception. What is often missed is that even solo experiences can be meaningful when approached with awareness. When attention is placed on breath, sensation, and presence rather than distraction or habit, the nervous system responds very differently. The experience becomes grounding rather than draining. At this stage of life, the goal is not intensity or repetition, it is integration. The integration of body awareness, emotional presence, and physiological balance. When men begin to approach their bodies with curiosity instead of habit, and awareness instead of urgency, something important changes. Circulation improves not just in the pelvis, but throughout the entire system. Nervous system regulation becomes more stable, emotional clarity increases, and most importantly, the sense of disconnection that many men silently carry begins to fade. When we bring all of these insights together, a clear pattern emerges. The challenges men face after 60 are rarely caused by a single factor. They are the result of accumulated habits, subtle physiological adaptations, and unnoticed behavioral patterns. But the most encouraging truth is this: the body remains remarkably responsive even in later decades of life. With the right adjustments, gentler stimulation, improved circulation, mindful pacing, pelvic awareness, balanced frequency, and emotional presence, many of these changes are not only manageable, but reversible to a meaningful degree. What I want every man to understand is simple but powerful. Aging is not a collapse of function. It is a shift in requirements. The body no longer responds to force, speed, or excess stimulation the way it once did. Instead, it responds to awareness, patience, and balance. When you align with that shift rather than resist it, the system begins to restore itself in ways that often surprise people. Vitality does not disappear with age, it changes form. And when you learn to work with it instead of against it, you discover that a more stable, grounded, and deeply satisfying version of health is still entirely possible. As we continue this deeper understanding of male health after 60, there's another layer that ties everything together, something that most men never consider until symptoms begin to appear in more than one area at the same time. When the pelvic region, nervous system, circulation, and emotional balance start to shift together, it is rarely coincidence. It is usually a reflection of long-term physiological adaptation finally reaching a threshold where the body can no longer compensate silently. And at this stage, the focus must shift from isolated fixes to system-wide restoration. One of the most important systems involved here is the prostate and its relationship with circulation and nervous regulation. The prostate is not just a passive gland. It is a highly vascular, hormonally responsive organ that depends on consistent blood flow and balanced neural input. When circulation is healthy, the prostate remains flexible in function with efficient drainage and responsive tissue behavior. But when blood flow becomes irregular due to posture habits, sedentary lifestyle, stress, or repetitive mechanical strain, subtle congestion can develop over time. This does not always appear as disease in the early stages. Instead, it shows up as mild urinary changes, slight discomfort, or a feeling that things are not as smooth as they once were. What makes this particularly complex is that prostate health is not only influenced by biology, but also by nervous system tone. The autonomic nervous system, specifically the balance between sympathetic and parasympathetic states, plays a major role in how the prostate behaves. When a man is constantly in a heightened stress state, even unconsciously, the sympathetic system dominates. This reduces optimal blood flow to the pelvic region and increases muscular tension in surrounding structures. Over time, This creates a functional environment where the prostate is less supported and more restricted. It is not inflammation in the traditional sense at first, it is dysregulation. This is why lifestyle patterns matter far more than most people realize. A sedentary routine, prolonged sitting, shallow breathing, and emotional suppression all contribute to a physiological state where the pelvic region is under constant low-grade stress. And when this is combined with long-standing mechanical habits that do not support circulation or relaxation, the cumulative effect becomes more noticeable with age. The key insight here is that the prostate does not decline in isolation. It reflects the overall state of the body's internal environment. Another critical aspect that often goes unnoticed is vascular health. The same blood vessels that supply the heart and brain also supply the pelvic organs. There is no separation in the circulatory system. So when vascular flexibility decreases with age due to lifestyle factors, metabolic changes, or endothelial dysfunction, the first signs are often seen in areas that depend on fine blood flow regulation. The pelvic region is one of these areas. This is why erectile changes, urinary flow differences, or reduced sensitivity can sometimes appear before more serious cardiovascular symptoms are even detected. In many ways, the pelvis becomes an early indicator of systemic vascular health. This is not meant to create fear, but awareness. Because when men understand that pelvic changes are often a reflection of whole body circulation, the approach to improvement becomes much more effective. Instead of focusing narrowly on one function, attention shifts toward improving overall vascular health, mobility, and nervous system balance. Walking regularly, maintaining hydration, reducing prolonged sitting, and improving breathing patterns are not just general health tips. They directly influence pelvic function in measurable ways over time. At the same time, we cannot ignore the role of the nervous system in shaping long-term patterns of response. The male nervous system is highly adaptive. It learns from repetition. If a pattern of tension, urgency, or mechanical repetition is reinforced over years, the nervous system begins to normalize that state. This is why some men experience a gradual shift in sensation or emotional response without a clear trigger event. The nervous system has simply recalibrated its baseline. What once felt intense may now feel muted, not because the body has lost capability, but because it has adapted to a different internal standard. However, adaptation is not fixed. The nervous system remains plastic even in later life. This means that with consistent changes in behavior, environment, and internal awareness, it can rewire itself again. When stress levels decrease, when breathing deepens, when movement increases, and when mechanical habits are replaced with more mindful patterns, the nervous system begins to shift back toward balance. This is not immediate, but it is real. Many men notice that over weeks and months, sensitivity, energy, and emotional responsiveness begin to improve in subtle but meaningful ways. There is also an emotional dimension that often runs parallel to these physical changes. Many older men do not openly express how their relationship with their own body evolves over time. There is often a quiet sense of detachment that develops gradually. This is not due to lack of desire or ability, but rather a combination of cultural conditioning, lack of education about aging physiology, and the absence of open discussion about male health in later life. As a result, many men begin to view their changing sensations as something to manage rather than understand. This mindset itself can contribute to further disconnection. When the body is approached purely as a functional system that is no longer performing as it once did, the emotional link between awareness and sensation weakens. But when the body is approached with curiosity, when changes are observed rather than judged, a different relationship begins to form. The nervous system responds strongly to this shift in attention. Calm observation reduces internal stress signals, which in turn improves physiological response patterns. It is also important to recognize that pleasure in its healthiest form, is not purely physical. It is a combination of circulation, nervous system balance, emotional presence, and cognitive engagement. When any one of these elements is missing, the experience becomes incomplete. This is why some men report that even when physical function is intact, the experience feels different. It is not a loss of ability. It is a change in integration. At this stage, the most important goal is not to chase past sensations or compare present experiences to earlier decades of life. That comparison often creates unnecessary frustration. Instead, the focus should shift toward optimizing what the body is capable of now. A 7-0-year-old body is not meant to function like a 3-0-year-old body, but it is fully capable of maintaining vitality, responsiveness, and satisfaction when supported correctly. The key difference is that it requires more awareness, more recovery time, more circulation support, and more intentionality. When all of these elements come together, improved circulation, relaxed nervous system tone, mindful habits, pelvic awareness, and emotional presence, the changes can be significant. Men often describe feeling more connected again, not in a youthful sense, but in a stable, grounded way. Energy feels more consistent. Sensation feels clearer. Emotional states become less flat. And perhaps most importantly, there is a renewed sense of control and understanding over one's own body. This is the real message behind everything we have discussed across these parts. The male body after 60 is not deteriorating in a simple linear way. It is adapting to decades of accumulated patterns. And when those patterns are understood, adjusted, and supported, the system responds. Not instantly, not dramatically, but steadily and meaningfully. Aging, in this sense, is not the loss of function, it is the refinement of it. The body becomes less tolerant of excess, but more responsive to balance. Less reactive to intensity, but more sensitive to consistency. Less forgiving of neglect, but more rewarding to awareness. And when a man learns to work with these principles rather than against them, he often discovers that a different kind of strength emerges. Not the forceful strength of youth, but a quieter, more stable strength built on understanding, regulation, and internal balance. And that is where true long-term vitality begins, not in resisting aging, but in learning how to align with it intelligently. As we move further into this discussion, it becomes clear that male health after 60 is not defined by a single organ, symptom, or habit, but by a continuous interaction between systems that have been running for decades. By this stage of life, the body is no longer experimenting or adapting rapidly, it is reflecting long-established patterns. And that is exactly why small corrections now can still produce meaningful change, because the system is still responsive, just more selective in how it responds. One of the most important ideas to understand at this point is recovery capacity. In younger years, the male body can tolerate stress, repetition, and even poor habits with relatively quick recovery. Blood vessels are more elastic, nerve signaling is faster, and hormonal fluctuations are more forgiving. But with age, recovery becomes the central factor that determines overall function. It is no longer just what you do, but how well your body resets afterward. This applies not only to physical exertion, but also to nervous system load, emotional stress, and intimate behaviors. When recovery is sufficient, the body maintains balance. When recovery is compromised, even small habits begin to accumulate strain. This is why some men notice that what once felt harmless now leaves a longer-lasting impact. Fatigue lingers more, sensitivity fluctuates more, and emotional resilience feels slightly reduced. This is not failure. It is a shift in physiological tolerance. And once this shift is understood, the approach to health naturally becomes more supportive rather than forceful. A major contributor to recovery efficiency is sleep quality. This is often underestimated in discussions about male vitality. But sleep is where hormonal regulation, tissue repair, and nervous system recalibration actually occur. During deep sleep phases, testosterone regulation stabilizes, dopamine receptors reset, and vascular repair processes are activated. If sleep is fragmented, shallow, or shortened, these processes become incomplete. Over time, this affects energy, sexual function, mood stability, and even cognitive clarity. Many men assume that occasional poor sleep is not significant, but the body does not average out recovery in a simple way. Instead, it accumulates deficits. A few nights of disrupted sleep repeated over months or years can have a stronger impact than most people realize. And because these changes are gradual, they are often misattributed to aging itself rather than underlying recovery disruption. Improving sleep quality is therefore one of the most powerful interventions for restoring balance across multiple systems at once. Another layer that plays a crucial role is metabolic health. Circulation is not just about blood flow mechanics. It is also about the quality of the blood itself. Blood sugar regulation, lipid balance, and endothelial function all directly influence how well oxygen and nutrients reach the pelvic region and other sensitive areas. When metabolic health declines, even slightly, vascular responsiveness becomes less efficient. This can subtly affect endurance, sensitivity, and overall vitality. What is important here is that metabolic shifts are often silent. A man may feel generally fine, while underlying changes in glucose regulation or lipid profiles are already affecting microcirculation. The pelvic region, again, becomes one of the first areas to reflect this because it depends on very fine vascular control. This is why improving metabolic health through consistent movement, balanced nutrition, and reduced sedentary behavior can have noticeable effects not only on heart health, but also on intimate function and overall energy. Breathing patterns also deserve attention, though they are rarely discussed in this context. Chronic shallow breathing, often linked with stress or prolonged sitting, keeps the body in a mild state of sympathetic activation. This means the stress mode of the nervous system remains slightly engaged even at rest. When this becomes habitual, it affects heart rate variability, circulation efficiency, and muscle tension throughout the pelvic and abdominal regions. In contrast, slow and deep diaphragmatic breathing activates the parasympathetic system, which supports recovery, relaxation, and improved blood flow distribution. This shift is not just psychological. It has measurable physiological effects. Blood vessels dilate more efficiently, muscular tension reduces, and the nervous system enters a more stable baseline state. Over time, this contributes to better sexual response, improved urinary comfort, and a general sense of internal calm. The key point is that breathing is not just an automatic function, it is a regulatory tool that directly influences male physiological balance. As we integrate all of these systems, sleep, metabolism, circulation, breathing, nervous system tone, it becomes easier to understand why isolated solutions often fail. Many men look for a single fix for a complex multi-system shift, but the body does not operate in isolation. Improvement happens when multiple small systems begin to align together. Even modest changes in several areas can produce a cumulative effect that is far greater than any single intervention. At this stage of life, one of the most powerful changes a man can make is reducing internal friction. This does not just refer to physical strain, but also mental resistance and emotional tension. Constant self-criticism, comparison to younger years, or frustration with changing abilities creates an internal stress loop that directly affects physiology. The nervous system does not separate emotional tension from physical response. It translates both into biochemical signals that influence circulation, hormonal balance, and muscular tone. When internal resistance decreases, the body often responds with surprising improvement. This is because energy that was previously spent on tension and correction becomes available for regulation and recovery. Men often report that once they stop fighting their current state and begin working with it instead, improvements become more noticeable. This is not psychological positivity, it is physiological efficiency. Another important aspect is consistency over intensity. In younger years, dramatic changes or intense effort may produce fast results. But after 60, the body responds more effectively to steady, repeated, low-stress inputs. Short daily walks, consistent hydration, regular sleep timing, gentle mobility work, and mindful awareness all contribute more to long-term vitality than sporadic, high-effort attempts. The nervous system, in particular, thrives on predictability at this stage of life. Predictable signals create stability, and stability allows repair. When we bring everything together, pelvic health, circulation, nervous system balance, metabolic stability, sleep quality, breathing efficiency, and emotional regulation, a clear picture emerges. Male vitality in later life is not about restoring youth. It is about maintaining coordination. When systems communicate effectively, even at a slower pace, function remains strong. When systems become disconnected, even small changes feel significant. This is why awareness becomes the most important tool. Awareness allows a man to recognize patterns early, adjust behavior gently, and support his body before imbalance becomes more pronounced. It transforms health from a reactive process into a responsive one. Instead of waiting for symptoms to appear, adjustments are made based on subtle internal signals. Ultimately, the goal is not perfection, it is stability. A stable nervous system, stable circulation, stable hormonal rhythm, and stable emotional baseline. From that foundation, function naturally improves to the best possible level for the individual's age and physiology. And perhaps more importantly, quality of life improves not in dramatic peaks, but in steady, reliable consistency. What many men discover when they reach this understanding is that vitality was never completely lost. It was simply expressed differently. And once the correct conditions are restored, the body often begins to respond in ways that feel familiar, but also more grounded and sustainable than before. At this final stage of understanding, everything we have discussed begins to connect into a single, unified picture of male health after 60. It is no longer about isolated symptoms, individual habits, or single explanations. It is about recognizing that the body is a long-term record of everything it has experienced, repeated, and adapted to over decades. And by this point in life, the most important question is no longer what is wrong, but rather what patterns are still being repeated that no longer serve the current physiology. When men begin to view their bodies through this lens, something important shifts. Health stops feeling like a constant struggle against decline and starts becoming a process of alignment. The nervous system, which has been shaped by years of repetition, begins to respond differently when those repetitions change. The vascular system, which has adapted to lifestyle patterns, begins to improve when circulation is consistently supported. And the emotional system, which has often carried silent stress for decades, begins to relax when internal resistance is reduced. One of the most powerful realizations at this stage is that the male body does not require extreme intervention to improve. It requires consistency in the right direction. Small corrections, when applied daily, compound into meaningful physiological change over time. This is especially true for systems like circulation, pelvic function, and nervous regulation, where gradual improvement is far more sustainable than aggressive correction. Many men assume that aging means inevitable decline in function, particularly in areas related to intimacy, energy, or control. But what is often misunderstood is that decline is not linear, it is patterned. And patterns can be modified. The body does not stop working suddenly. It gradually shifts in response to signals it has been receiving consistently. When those signals change, the system begins to recalibrate. Not instantly, but steadily. At this stage, it is also important to address mindset. The way a man interprets his own changing body has a direct physiological effect. When changes are viewed as failure, the nervous system enters a subtle stress response. This increases sympathetic activity, which reduces circulation efficiency, tightens muscular tone, and affects hormonal balance. Over time, this reinforces the very symptoms that cause concern in the first place. However, when changes are interpreted as adaptation rather than decline, the internal response is different. Stress signaling reduces, breathing becomes more regulated, muscle tension decreases. The body shifts into a more receptive state for repair and regulation. This is not positive thinking in a superficial sense, it is neurophysiological regulation. The nervous system responds directly to perception. Another important concept is sustainability. At this stage of life, the goal is not to maximize output, but to maintain functional stability over time. That means avoiding extremes in all directions, extreme exertion, extreme restriction, extreme stimulation, or extreme inactivity. The body thrives in moderation because moderation reduces internal stress load, and reduced stress load allows recovery systems to function more efficiently. When men adopt a more sustainable approach, they often notice that their energy becomes more predictable. Instead of sharp highs and lows, there is a steadier baseline. Instead of fluctuating sensitivity, there is more consistent response. Instead of emotional volatility, there is greater internal stability. These changes may seem subtle, but they significantly improve quality of life. It is also important to understand that the body at this stage prioritizes preservation over performance. This means it becomes more sensitive to stress signals and more conservative in energy distribution. When this is misunderstood, men often try to push harder, expecting previous levels of response. But when it is understood correctly, the approach shifts towards support rather than force. And this is where real improvement begins. The pelvic region, circulation system, and nervous system all respond very well to gentle, repeated reinforcement. Walking, stretching, controlled breathing, and relaxed awareness are not minor interventions, they are foundational regulators of function. They help restore communication between systems that may have become less synchronized over time. And when that communication improves, function improves naturally. Emotionally, this stage of life also offers a different kind of strength. It is less about external validation and more about internal stability. Many men begin to realize that true confidence is not based on peak performance, but on reliability of function and comfort within their own body. When discomfort, confusion, or disconnection decreases, confidence naturally increases, not because anything external changed, but because internal alignment improved. What becomes clear across all of this is that male vitality is not something that disappears. It transitions. It changes form. It becomes less about intensity and more about coherence. Less about force and more about regulation. Less about chasing past experiences and more about optimizing present capacity. And perhaps the most important truth is this: the body is always responding. Even in later decades of life, it is listening, adapting, and adjusting based on what it is consistently given. When the inputs improve, the outputs improve. When stress reduces, function stabilizes. When awareness increases, imbalance decreases. So the final message is not about restriction or fear, it is about responsibility and understanding. The male body after 60 is not a system in decline. It is a system that requires a different kind of attention, one that is more patient, more observant, and more aligned with natural physiology. When that shift happens, men often discover something unexpected. They do not return to their younger selves. Instead, they arrive at a more grounded version of themselves, one that is less reactive, more stable, and often more at peace with their own body than they have been in decades. And that is the real outcome of this entire process. Not restoration of the past, but refinement of the present.